Welcome to Schein Chats. My name's Patrick Allen and I'm the Managing Director of Henry Schein in the UK and Ireland. Joining me today is Shaenna Loughnane. Shaenna is the CEO of Bridge2Aid, a dental charity based in the UK, operating in Africa, and a good friend of Henry Schein. We've done lots of work with them partnering over the years. Shaenna, thanks for joining us today. Why don't you tell us a little bit about Bridge2Aid?
Sure. So we were founded in 2004. So our founder, Ian Wilson, was a dentist working in Tanzania. And he was going out and taking out teeth and trying to do fairly complex dentistry kind of in the middle of nowhere. And he just felt, do you know what, this isn't a sustainable solution. So I'm getting back on the plane, going back to the UK, having treated lots of patients, but actually he wasn't making a difference to the structure of the country or the long-term kind of livelihoods and lives of people. So he kind of came up with our model, which is we train health workers, rural health workers, who are based in the rural areas of Tanzania, and they look after anywhere between kind of 10 and 20,000 people. So they do all the medical services for around about 10 to 20,000 people, dress wounds, deliver babies, but they've never had any dental training. So he saw this as a real opportunity of kind of creating a sustainable training model. So we send volunteers from the UK out to spend 8 days with the clinical officers, training them in some simple basic emergency dental care, so that they can then go back to their communities and look after the people that they're living amongst.
So when did you get involved?
I got involved back when I first volunteered at Bridge2Aid in 2006. So myself and my husband ran a couple of practices in Gloucestershire. And we were looking, as a team and as a practice, we were looking for a charity that actually made a long-term difference and did something. We'd done lots of fundraising and we'd kind of done our dressing up days and our cycle rides, but we really wanted to use the skills of the team to make a difference with all those unique skills they had. So we Googled and found Bridge2Aid, so that's when I first got involved. And then in 2011, I left the practice and started working for Bridge2Aid full-time.
So you've taken part in the programs, participated?
Yes, yeah, I've been a volunteer on the oral health teams in the program. So I've done, I think, 4 volunteer programs myself, and then I was just so struck by the kind of difference it was making to people's lives, and how it was, you know, the problem of 75% of the world having no access to dental care is so big and so kind of, so how can we solve that? But what struck me when I volunteered on the programs was that actually you can make a difference, and you can make a long-term difference just by giving a couple of weeks of your time. And so I got very passionate about the work very quickly. So that's how I got involved. And then our practice as a team, 24 of the team have been out to Tanzania on the programs. 10% of our turnover kind of went to Bridge2Aid, so it was really key to what we did as a business.
Brilliant.
And now I work there myself, so yeah.
Fantastic. And you talk a lot about impact and sustainability, and you know, we've been partnered for, I don't know, 12 years, and it's always the 2 words that keep coming up: impact, sustainability. And your model is a little different to a lot of the activities you see. Tell us a little bit more about how you create that sustainable model, and you know, what legacy that leaves in the areas you work.
Yeah, I think the key thing is to work with what's already there. So rather than kind of seeing this problem and thinking, okay, from the UK, we've got a solution, we're going to fly in, we're going to help you, and fly out again, that whole kind of white saviour attitude to making a difference. And
although that does make a difference to the individuals.
It does, it absolutely does. But for us it's about work, so we work with the government in Tanzania, and we're just kind of looking and talking to other governments at the moment. So we work with the Ministry of Health there, and it has to fit with the programme they already have and the healthcare structure already in place. And we work with them, as I say, to train the clinical officers. So when we get back on the plane, those skills are still there. And the majority, so this is our 15-year anniversary this year. Right. And in that time we've trained 570 clinical officers, and the majority of those are still using those skills, still using the equipment that we've given them, and still treating their communities, and that's kind of what makes it sustainable. So it's about leaving the skills behind, but also enhancing the healthcare structure that's already there rather than working against it.
Fantastic. And a major achievement for me was when you were referencing the oral health strategy back in, was that 2017?
Yeah, so the oral health strategy of the charity.
Yeah. But also of the Tanzanian healthcare system. Yeah,
so basically they were looking at kind of the healthcare structure as a whole, and that strategy as a whole, and we were kind of inputting into that along with the the Chief Dental Officer of Tanzania, so he was consulting with us on that. So it was great to have some input into that. And at the moment, we're just about to launch an oral healthcare survey within Tanzania.
Right.
Ourselves and Miracle Corners of the World are another partner, and we're really looking, at the country. Where are the problems? What can we do to help those, rather than just assuming we know? So that survey is just about to kick off in the next month or so, which is great.
So 15 years. Could you give me your top 2 or 3 achievements in those 15 years?
I think, as I say, training 570 clinic officers. So we've given access to about 5.7 million people in Tanzania who didn't have any access to any kind of dental care before that.
Yeah.
So we've touched the lives of around about 5.7 million people. Last year we ran our first oral health education program, so now we're very much focusing on the upstream approach as well. So yes, we can treat the problems at the end, but let's try and do a little bit of preventative work as well. So we're working with clinical officers and therapists in Tanzania to kind of on the preventative side as well. During our programs we do treat patients, so as you were saying, kind of flying in and flying out, you are treating patients, so we do that as well. So over the time we've treated around about 58,000 people on our programs, so that's kind of our top stats. But obviously
making a huge difference. It's incredible.
It is making a huge difference, yeah.
And where do you access volunteers, or where do you find your volunteers?
So
clearly you're recruiting here, I can see that.
Yeah, absolutely. So at shows like this, so we engage with the whole of the kind of dental industry in the UK, both kind of corporates and dental practices. So we get our volunteers from shows such as this, from going into practices, and it's mostly word of mouth, to be honest. So over the 15 years, I think we've had 935 volunteers, but out of those, sorry, I'm one for my stats, so 38% of our volunteers, clearly, 38% of our volunteers come time and time again, because they've had such a great experience. So I think, it's just engaging with the industry, engaging with companies such as yourselves. You then talk to your clients and the word just kind of spreads. Yeah. We've also got Bridge2Aid Australia. So we work with Bridge2Aid Bridge2Aid Australia as well. So we've run our first down there. We've run our first program staffed just by volunteers from Australia this year. So that was great as well.
And originally you had a team from the UK based in Tanzania. More recently that team has become staffed by Tanzanian locals.
So our founder lived in Tanzania for 10 years, and a couple of the other team for about the same amount of time. But we've been slowly kind of coming away, and so we had our own Tanzanian team up until the end of last year, and then we decided that rather than us kind of employing the team, it was good for them to create their own NGO. So they've created their own charity, Education and Health for All, which is all 3 directors have worked with Bridge2Aid for a number of years. But they now work as our partners because it's their country, they know what they're doing, they understand where we should be going and how we should be kind of helping their communities. So that's really exciting that they were our team and now they're their own NGO, looking after it themselves, running up the programs for us, which is great. It's lovely, it's fantastic to see the way they've kind of developed that themselves.
Yeah. So you're having huge impact on the communities, on the patients.
Absolutely, yeah.
That's amazing, and on the volunteers. So last question, I guess. What about the trade in terms of how do you partner with industry? I mean, as I say, we partnered for years.
Yep.
You help people to do amazing things through supporting you.
Absolutely. I mean, we're called Bridge2Aid because it's not about dental bridges. It's about bridging those who want to make a difference with those who kind of need that help. So yes, we are training people to treat people that have been in pain for 9-10 years. They have no hope of help, so we're training the clinical officers, but we're also helping those here that actually want to do something but they're not quite sure how to do that. So yes, we've got volunteers that will go out to our programs. We've also got people that do fundraising events for us. We've got corporates such as Schein who have actually been out to Tanzania and witnessed things firsthand and done programs.
And it was amazing.
And that you did, yeah, which is fantastic. People are cycling for us, which again you're doing in 2 weeks' time. And just they then feel that they're part. So Bridge2Aid, we call it the Bridge2Aid community because it's not just 4 of us in an office in Gloucestershire. It's not just the team in Tanzania. It's not just those 77 volunteers a year that get on a plane. It's about the whole industry working together and doing their bit And not everyone can get on a plane and come to Tanzania, but you can fundraise, you can advise. We have advisors within the industry that help us with our clinical standards and the work that we're doing. So it's kind of, there's lots of different levels and lots of different ways of getting involved.
Fantastic, Shaenna, thank you. Finally, what's next? What's
next? So very excitingly, we're running our first pilot program in Malawi next year. So for the last 15 years, we've been working in Tanzania. We've now, 2 weeks ago, I was in Malawi meeting with the Ministry of Health there and the president of the Malawian Dental Association, and they've kind of given us the green light that they want us to run our programs in Malawi, which is very exciting. So our pilot is in June next year, and that's actually a partnership and a collaboration between lots of different partners. So the MalDent project, which is something being headed by Glasgow Dental School, Jeremy Bagg at Glasgow Dental School. They've just opened the first dental school in Malawi, and the first cohort of students started in September. And there's a whole team of, so obviously Henry Schein are involved in that partnership, Bridge2Aid is, we've got the Malawian Dental Association, we've got Smilawi, another NGO based in Scotland. So all of us coming together to make a long-term difference to the oral health of one country, which is really exciting, and it's a fantastic example of kind of private and public and charity partnerships working really, really well, and obviously Henry Schein is a really key part of that, and it's been great.
Thanks, Shaenna. Shaenna, it's been a pleasure talking to you. Your passion for your organisation just flows out of you. It's fantastic to see the impact you've had, the difference you're making, sustainability and impact. It's fabulous. So thanks for joining us.
No, thanks for having us.
Thank you for joining us for Schein Chats. We look forward to seeing you soon.